Stakeholders gathered at the Coronation Hall of the Government House in Kano for the Kano State House of Assembly public hearing on the 2026 budget, presenting a memorandum on behalf of the Resource Center for Human Rights and Civic Education, Chriced. The organization's program officer, Hajiya Zuwaira Omar Muhammad, represented the executive director, Dr. Ibrahim M. Zikirullah, while commending the leadership of the House for its openness and people-centered approach to legislation. Chriced raised concerns that the realities faced by mothers and children, particularly in rural communities, remain troubling.
The Resource Center for Human Rights and Civic Education commends the leadership of the Speaker, principal officers for their accessibility, open door policy, and commitment to the people-centered legislation. Honorable members, despite repeated allocation to health, education, and social services, the life reality of citizens, especially mothers and children in rural community, remains dire. Preventable deaths continue to occur, exposing deep cracks in our healthcare delivery system. Every preventable death is not just a statistic. It is a family shattered, a community weakened, and a future cut short. Honorable members, it has been 2.5 years since the Kano State Free Maternal and Child Healthcare Law 2023 was passed and assented to. Yet, its implementation remains stale. This is not a honor, but to the Ninth Assembly, which labored to enact this landmark legislation, and to the people of Kano State who stand to benefit from it. While we acknowledge commendable initiatives such as the maternal and neonatal mortality reduction, innovation and incentives, MIME, and the sector-wide approach, SWAP, the persistence of high mortality rates underscore the urgent need for full implementation of the Free Maternal and Healthcare Law.
Findings from Chriced's service availability and readiness assessment conducted across 91 primary health care facilities in 11 local government areas revealed significant infrastructure and service gaps. Many facilities lack clean water, stable electricity, and functional delivery rooms. The assessment also showed that nearly 46% of patients still make out-of-pocket payments at primary health care centers, while essential drugs such as magnesium sulfate are frequently unavailable for extended periods. Chriced also mobilized community delegates from across local government areas to ensure that grassroots voices were represented in the budget process. On the challenges slowing the implementation of the Kano State Free Maternal and Child Health Care Law 2023, Chriced's Senior Program Officer, Dr. Omoni Adewoye, outlined key factors.
The slow pace in the implementation of the Kano State Free Maternal and Child Health Care Law is not in the best interest of women and children in the state. While we commend the government's efforts recently in trying to, commit more resources, to addressing maternal and child mortality in the state, just like we have always argued, the spirit behind initiating the law is to ensure that access to maternal and child health care is a matter of right and not privilege. So implementing the law without setting in place the mechanism that the law has provided for its own implementation, like the governing council that is supposed to oversee the implementation of the law, is not in the best interest or in the spirit of the law itself. So we call on the state government to, as a matter of urgency, commence the formal and official implementation of the law. And how do they do this? By setting up the governing council or the council stipulated by that law for its implementation. Also, let there be specific budgetary provision for the implementation of Kano State Free Maternal and Child Health Care Law.
Chriced also expressed concern that more than 2 years after the passage of the law, it is yet to be fully implemented. The organization called for dedicated funding in the 2026 budget, the establishment of the Free Maternal and Child Health Consultative Council, and stronger legislative oversight.